I'm joined now by Dr. Andrew Cooper. He's an orthopedic surgeon. We also have Kent Carlson here. He's a patient, and we're talking about a brand new clinical trial happening at Salt Lake Regional Medical Center. Dr. Cooper, tell us what it's about.
This trial is designed to replace lost meniscus with an artificial meniscus and try and preserve the knee from becoming more arthritic with time.
All right, what is a meniscus for people who are saying, I know that that causes pain, but where exactly is it?
So a meniscus is a padding between the bones and the knee. There's two of them, a medial and lateral one, and they distribute force. So if you were to tear it, whether it's slipping on ice, skiing, or getting out of bed awkwardly, it becomes an irritant and can advanced arthritis. So then some people will lose their meniscus. And if you lose that padding, it can be problematic also. So the study is designed to try and replace that padding.
So Kent, you know exactly what a meniscus is and where it is because you had a tear in yours?
That is correct, yes.
What happened?
I think it just happened over years of abuse.
Are you a runner? Are you a skier?
Skier, and then my life activities, what I do for a living.
How did it affect your quality of life when it happened?
Over time, it got to be to the point where I couldn't do anything at all.
Can you describe, I mean, I'm sure there are people out there that have felt the pain of a tear, but can you describe it?
Well, the tear wasn't the problem. It was the fluid that was building up from the tear that was immobilizing me and not allowing me to do anything at all.
So you'd get out of bed every day, and how'd you feel?
In the morning I was great. By the end of the day I wasn't so good.
Dr. Cooper, is that pretty common with your patients?
It is. I mean, the symptoms can vary. You know, some people get some locking, catching pain, and stability, and a lot of people get some swelling, you know, like Kent had, and those are just the differences in individuals, and that's why the diagnosis can be a little bit challenging.
So Kent, tell me why you decided to participate in the study.
I wanted to prevent a complete knee replacement. When I heard about this on the radio, I jumped on the phone and called immediately and got in.
You weren't nervous to try something new?
No. No, what's the alternative? A complete knee replacement.
So how does your knee feel now?
It's doing quite well. It's not 100%, but I'm active again. I was able to ski this year, and I'm doing a lot of things that I enjoy doing.
I saw you walking down the hall, and it was a pretty good gait. Yeah. Looks like you're feeling great. Yeah. And is that what most of the people part of the trial are reporting back to you?
Yeah, and I think that, as Kent described, they're trying to get back to their activities, you know, and I think pain inhibits us from doing that, and then it affects our health and our wellness, and that's the goal here, is to keep people healthy.
What type of commitment is it to be involved in a trial like this?
A trial like this can be somewhat onerous because it's controlled by the FDA, and we have to follow people out all the way to 5 years. So they definitely have to agree to all of the study protocol, which is seeing us regularly for their follow-ups, getting follow-up MRIs, doing the therapy, and then going all the way out to 5 years.
But Salt Lake Regional Medical Center, the only hospital in Utah chosen to participate in this study. So this is exciting. Something new for patients who just can't get rid of that pain in their meniscus.
It is very exciting. I think this is where technology is coming around to help us with a problem that we don't have a solution for.
If you're sitting at home wondering if you qualify, how do you know?
Well, you have to have had previous surgery on your knee to remove part of your medial meniscus, and then you can't have advanced arthritis. So what we're trying to do is preserve the knee and inhibit that arthritis. And so you have to have had those two things. And there's other criteria that we would go through with the patient, and it's a little bit stringent, but